As the state reaches another record day of COVID cases, the Premier has this message. We need to learn to live with the Delta variant because COVID zero has become unrealistic. Gladys Berejiklian says Delta will still be with us when the state and country start to reopen at the end of the year. Nevertheless, she says the mission for now is to get the numbers down. Another 681 people have the virus, and a man in his 80s with underlying health conditions has died. A record 132,000 people had the jab yesterday, and the state's on track to have injected 6 million vaccine doses sometime next week. However, the regional lockdown has been extended as the virus spreads. Tonight, we have reporters across New South Wales. We begin in Sydney with state political reporter Ashley Raper.
If the virus is here to stay, this appears the only path to freedom.
I know these are challenging times, but I also can see the light at the end of the tunnel.
Today the numbers were worse than they've ever been in the state. And there was another death. A man in his 80s died in St George Hospital. With the worsening numbers, a concession from the Premier.
Everybody's going to have to learn to live with Delta. Admittedly, in New South Wales, we're learning that earlier than others.
By everyone, she's including those outside her jurisdiction.
Every state in Australia will have to come to terms with the fact that when you get to a certain level of vaccination and start opening up, Delta will creep in. We can't pretend that we're going to be zero cases around Australia.
Now, I think the Premier is being very realistic, given the status of the serious Delta outbreak that we're seeing there.
The Prime Minister then clarified the national strategy.
Suppression cannot be dispensed with for vaccination when you have the vaccination levels we have now.
The Pfizer from Poland is now being administered to younger people in Sydney's hotspots.
Oh, it's bloody good. Like, you're really fortunate to be in an area where you're actually able to get vaccinated.
Everyone just knows this is something we have to do now.
At the moment, we have about 165,000 bookings, and that's been in the last 24 hours. We've had that strong surge come forward, which is great, but obviously we need a lot more.
Their aim is to have more than 500,000 people done in 2.5 weeks.
Once we hit those higher vaccination rates, life will feel much better. Life will look much rosier.
People of New South Wales are starting to lose hope because the only light they can see is a freight train coming straight for us. Stop the mystery. We need a pathway out of this.
The Premier has promised a plan, or a roadmap as she's calling it, is coming. It's likely to be based on the national plan that's already been released. But Gladys Berejiklian seems determined to forge her own path, given the situation New South Wales is in.
We're focused on the roadmap, we're focused on the light, we're focused on the way in which we can move forward.
But right now, the reality is rising cases. And in Campsie, an apartment block has just been locked down after the virus infected 9 people across 5 apartments. Ashley Raper, ABC News, Sydney.
Police are warning people about a COVID vaccine scam in Sydney. Cayman Gok is at police headquarters in Parramatta. Cayman, the fraudsters have been targeting people on a social media app.
Jeremy, police say the scammers were using the messaging app WeChat to trick people into signing up for vaccines they weren't eligible for. About 60 people registered for priority vaccines set aside for essential healthcare workers. Some paid $300 just for the booking. But of course, when they went to prove their eligibility, they couldn't. Police are now investigating how their employment status was changed in the booking system and are also following the money trail to find who is responsible.
We have reached a new level of selfishness when we have people who want to capitalise on community anxiety at the expense of our wonderful nurses and our essential healthcare workers.
Jeremy, the scam has since been shut down. So far, no charges have been laid.
Cayman Gok reporting. The regional lockdown has been extended for another week. It's now in line with Sydney. Authorities are worried about the growing number of cases, particularly in vulnerable communities in the state's west. Bill Ormond is live for us in Wilcannia tonight. Bill, there are yet more COVID cases there.
Jeremy, there are 3 more COVID cases here in Wilcannia, and there's a growing sense of anxiety amongst the community, with hundreds still yet to be vaccinated. Now, the source of the initial outbreak here in the far west is still unknown, but the town here in Wilcannia is doing everything they can to stop the spread. There are only a few reasons to be out and about in Wilcannia right now. One is to get vaccinated, another is to be tested for COVID-19.
We call on anyone who has been in or near Wilcannia in recent days to please get tested.
Another 3 cases have been detected in the small outback town. 130 people received vaccinations here so far. With often large households isolating, local support services are worried that tensions could rise within homes.
If there's lack of food, if there's lack of space and all kinds of stuff, been worried about that.
5 kilometres gets us to the other end of town. It doesn't get us the 200 kilometres to the big Coles or Woolworths store.
Volunteers are delivering care packages.
We want to support people who are positive cases and so in isolation because they're really struggling.
There were 21 cases in Dubbo and 4 in Mudgee, bringing the region's total to 167.
Out of those 4 patients in hospital, 1 of those is in intensive care.
There's now a greater geographical spread of cases to places like Goulburn, Kempsey and Queanbeyan, and virus fragments have been found in sewage in Foster, Yamba and Baddo Bay. So the statewide lockdown is being extended, at this point, until the end of next week.
It is right that we stay in front of the curve, that we stay in front of the spread, and we keep regional and rural New South Wales in lockdown.
People living in the west and northwest are highly connected, and travelling between towns is usually common.
No one had been vaccinated, and it was not because of hesitancy, it's because we didn't even have the choice to be vaccinated.
The ADF have been working in Dubbo, but their vaccination teams are still on the way.
We're very happy to be here. We hope that we can assist the community in recovering from this pandemic.
At the moment, regional New South Wales needs all the help it can get. Bill Ormond, ABC News, Wilcannia.
Meanwhile, more infections have been reported in Bourke and Gilgandra. Gary John Lysart joins us now from Bourke. Gary John, how is the community there holding up?
Jeremy, community members here and health authorities say the situation in Bourke is dire. They're really concerned about the spread of COVID-19, particularly in Bourke's Aboriginal community. Community members here are loath to leave their homes for anything but the most essential of reasons. Local health authorities have been ratcheting up their vaccination efforts, and tomorrow they're going to be heading to the Alice Edwards village. It's a former Aboriginal mission on the outskirts of town.
There are about 14 houses with up to 10 people per household, and we're planning to go house to house and vaccinate that community.
Now, Jeremy, the Australian Defence Force will be arriving in Bourke early next week to continue helping with that vaccination effort.
Gary John Lysart in Bourke. Big changes are on the way in the state's north. Leah White is at Tweed Heads on the Queensland border. Leah, life is about to get a bit tougher for locals there.
Yeah, that's right, Jeremy. It's quiet here at the border checkpoint because only a select few people can pass. The Queensland government is about to make that list even shorter. The deadline is looming for essential workers who will need a jab to enter by the weekend. Many say that deadline is too tight, and already we're hearing heartbreaking stories of how the border closure is affecting lives in the region. Baby Davina has a cyst on her brain.
She's really happy now thanks to pain relief, but without it, she can be really upset. Do you want to actually write a word?
Davina desperately needs an MRI, but the closest children's hospital is 2 hours away in Brisbane. And because her family is from New South Wales, tomorrow's appointment has been cancelled.
That help seems to have just, been ripped away from us.
That's horrifying to Kimberly Brown. She and her husband lost an unborn twin when the border was shut last year. After suffering pregnancy complications, Mrs. Brown was flown to Sydney instead of a closer Queensland hospital.
There is a line that is drawn on a map that says that we can't cross to go to that hospital. It just seems ridiculous.
The barricades are back, only a few essential workers can cross, and from Saturday they have to carry proof of at least one COVID shot.
It only takes one person with that virus to bring it into Queensland, and then all bets are off.
Truckies too need to take a test every week. something Kevin Wells is finding easier to do in the Sunshine State.
They're saying 24 hours to 48 hours, whereas New South Wales has been 4 to 5 days.
The border checkpoints are also making it difficult for the building industry. Tradies say they're having trouble getting supplies from Queensland.
The major Queensland-based companies have chosen to boycott the industry within our area purely on the basis that economically it's no longer viable to have a truck driver sit in a truck at a checkpoint for 6 to 8 hours.
If Queensland has its way, 100 troops will return to guard the border.
I'm making no apologies for keeping Queenslanders safe.
Hey, Baba. But some just to the south feel like collateral damage. Hey, Baba. Leah White, ABC News, Tweed Heads.